And today we're going to be talking about the impact of neuroinflammation on mental health. And it's an important topic. It's something that I do talk a lot about, not just here, but in my one-to-ones when I work with people in our brain behavior reset program. So this is It's Going to Be Okay. So we're talking about how neuroinflammation impacts mental health. And this is something we should all be talking a lot more about because neuroinflammation is much more common than people realize. So we're going to dive into why neuroinflammation happens and how it actually affects the brain. Because when we have these conversations, it leads to identifying root causes and helping people, right? And, if you're following me and you're listening to me, a lot of times when people come to me, and this is why we're having this conversation, is they're coming to me because they or their child haven't gotten better doing traditional things, right? What are traditional things? Somebody literally just left and got in an airplane from a different state, obviously, and had done psychiatric medications, therapy, a variety of other interventions, all for a young child, right? And that was all that was offered. And this mother listened to her intuition, also listened to her friend who directed them towards me, and we're getting to these root causes. And yes, if you do want to work with me, you can go to drroseann.com/help, take our solution matcher, which will guide you to the right solution. But I'm doing this so that you can have aha moments and you can take charge of your own family's mental and physical health. This is a starting point. This is an education. First, there's knowledge, then there's action, right? We can't just wish, we can't just pray. Those are great things, but we have to actually take action. So let's talk about and understand neuroinflammation. Let's just start with that, right? So what is neuroinflammation? Why does it happen? So sadly, in all these decades of working with kids, and I do QEEG brain maps, please go back and listen to those episodes. But it's a way for me, it's essentially a brain scan where I can see the health of the brain. It gives me a visual representation of the brain, what areas are overstimulated. We see that with neuroinflammation, or understimulated. That can sometimes happen too, in long-term neuroinflammation. So why does it happen? Why do I see it all the time in these brain maps, right? Because saying that I've done a lot of brain maps. And today, when kids come to me, even more than adults, which is not supposed to happen, kids have neuroinflammation pretty much most of the time. Yes, we all know I work with a lot of kids with PANS-PANDAS, autism, mood disorders, and they're just prone to it. But I see it in kids that maybe sometimes we're just doing a brain map because we have a new clinician and we're testing out, brain maps on all our friends' kids. It is there. So let's talk about the sources and why, what are some of the reasons? So number one, food, right? So some of it is improper diet, not getting enough of the right nutrients to help your brain and body. Some of it is actually eating poor food quality. So just because you're getting organic chicken nuggets and that's the only food they're eating doesn't mean because it's organic, it's the right thing. No shame. This is just about understanding neuroinflammation. We already have enough shame and worry. I just want you to help to understand when we don't have a variety of foods, the rainbow of colors in both vegetables and fruit, we just aren't going to get the nutrients we need in our brain and body. And why do we need those nutrients? Detoxification. We need the nutrients for our system to actually work, including our neurotransmitters, our immune system, our hormone system. It is a symphony in our body. And these nutrients are the instruments in the symphony, right? And so these things have to be working, right? Stress, genetic mutations, clinical conditions, infections and toxins like mold, other different types of things. These are all things that can cause neuroinflammation, inflammation in the brain. Now, because I do QEEG brain maps, I'm able to actually see when we have neuroinflammation in the brain, which is a helpful diagnostic tool, because when it's there, we need to address neuroinflammation, right? And there's lots of ways. But let's talk about how it actually impacts mental health, right? And what actually happens. So, first of all, from a brain perspective, what actually happens in the brain. So we have, you can have neurodegenerative issues in the brain when there is neuroinflammation, which is really scary, right? I think one of the most talked about incidences was, oh my gosh, what is his name? I'm having a time change week. But Chris Christopherson was labeled, I believe it was Chris Christopherson, labeled as having Alzheimer's. And, he didn't have Alzheimer's. He actually had tick-borne illness and he had all this brain inflammation. And they believed he had a neurodegenerative disorder. Now, I don't know what actually happened in his brain, but long-term inflammation can degrade the brain, right? And you're like, what do you mean, Roseann? Yes, it can happen. And kids sometimes get tick-borne illness or strep or other things right out of the gate. And so we have to look at that. Head injury can cause neuroinflammation. There is a variety of reasons why we have it. And head injury, as most people are very misinformed on head injury, they think you have to be knocked out and concussed. Yes, that can lead to it, but it also can be birth trauma. Also, just recently had a client come out for a birth trauma. It actually was the source of all the issues that this person was having. It was not their diagnosed ADD and disruptive mood disorder. Those are just diagnoses. That doesn't mean that is the root cause. So hopefully that's an aha moment for you. So neuroinflammation affects how the neurotransmitters work. So when we have inflammation in our brain, regardless of the source, and many people have multiple sources, right? I just mentioned a few. Even long-term sleep problems can cause neuroinflammation, right? Hormone disruptions, neuroinflammation. There's a lot of reasons, but it can affect how the neurotransmitters are working. If our neurotransmitters aren't working, what is that going to lead to? Mental health issues, right? So that's a connection, right? It also can disrupt the blood-brain barrier. And if you're somebody with infections and toxins, in fact, impacting your mental health, we need a tight blood-brain barrier so those infections and toxins aren't going in. And if you have neuroinflammation and you're not detoxifying, the toxins right there without infections can filter back. Everyday toxins, because our body is a big filter trying to work to clean out all these things in our environment, right? It can lead to impaired neural repair. So our system, our function in our body, there is always something that is cleaning and helping our neurons work properly. And when we have inflammation, they can't work properly. And that means physical and mental health issues can result. Now, cognitive and behavioral changes can happen with neuroinflammation, right? So your attention can be affected, your memory, right? All of these things can really have a huge negative impact and can show up as, in the case of the young man, who recently came to see me, as having attention problems or learning problems. It also can just be an exacerbator of what is genetically there too, neuroinflammation. But again, it's much more common and misunderstood and not really talked about, right? We're not really talking about it. Now, one of the things that, in terms of neuroinflammation and how it actually works on that body level, right, on the neuroscience of it, is that we have inflammatory cytokines and it can alter our neurotransmitter levels, right? It creates this storm in our system where the body isn't working properly. And in the case of PANS and PANDAS, the body can actually start attacking itself and leading to increased inflammation. So there is sort of the dog chasing its tail, right? More inflammation causes more inflammation as you have this sort of cytokine storm occurring, right? And when this is going on, we talked about this affecting our cognitive, right? But stress builds within the system. It moves your nervous system, that autonomic nervous system. It moves you into a very sympathetic dominant stress state. So that is why we have kids with autism as a known neuroinflammation condition. We know this through post-mortem studies that about 76% of adults who have passed when they've done autopsies have neuroinflammation, right? And that's why there's such a crossover with autism with PANS and PANS. About 1/3 of people with autism are also diagnosed with PANS and PANS, according that's to research that was discussed at a conference. But we know that it can lead, all of these neuroinflammation can lead to behavioral changes, right? So food avoidance, when my Max started food restricting at, 2 years old, my pediatrician just quickly pushed me off and said it's normal toddler behavior. And I was like, ain't no normal toddler behavior when at all for kids to just stop eating. We need to stop normalizing things like that. We need to pay attention. When there is a sudden change in behavior, we need to look at why, right? And in the case of my Max, he had massive brain inflammation to the point where his pupils were dilated. So sometimes our kids with neuroinflammation, not all the time, the enlarged pupils is a giveaway. It's a very visible way to see neuroinflammation in the brain. And it also can lead to sleep problems, again, food restriction. These are things that are going to exacerbate the actual neuroinflammation, right? By not sleeping properly, 90% of detoxification in the brain occurs at sleep. So it creates this like perfect cascade of a horrible situation, right? So if we have neuroinflammation, it's going to affect neurogenesis, and that means that our brain can't repair itself. So what do we do? How do we address neuroinflammation? How do we treat it, right? So some of the things that I talked about, which break down, are actually part of the treatment, right? So the number one thing we can do to address neuroinflammation, anybody? Diet. So by having an anti-inflammatory diet, that's why it's called an anti-inflammatory diet, that is actually the quickest way. Everyone always thinks it's a long-term game. It's not a long-term game. It is actually the quickest way to reduce inflammation. Day one will start reducing your inflammation, right? The most researched anti-inflammatory diet is a Mediterranean diet. So that means that, the perfect anti-inflammatory diet has a lot of fruits and vegetables, really high quality protein, either no or complete or very clean levels of, or I should say clean options for wheat. So that means organic or imported from Europe, New Zealand, Australia. Those are they just have very strict regulations on their food that we don't here, and some of the other countries don't as well, including Latin America has a variety of rules on their food. And also, not having one of the most predominant inflammatory foods is dairy. So I know that's hard, but we're talking about ways to combat it, and food is a big one. We also want to make sure that we have proper gut health. The gut-brain connection is real. The vagus nerve is what connects the gut and the brain. And that means there is a bidirectional communication going on. So not just your food and making sure we're having fermented food, prebiotic foods, but also that we're having probiotics and really high quality probiotics. Please never buy your probiotics on Amazon. We're talking about getting them from a local health food store or a provider like myself, and making sure that it has something in the billions, not the millions. There are all kinds of probiotics. I know people always like to ask me, but I like to make sure that it's broad spectrum or it's specific to that condition. And there are definitely ones. I love Design for Health. I love Clear Labs. I know there's other ones out there, and you have to ask your provider. But probiotics are safe. They even have some for infants. And you, again, always check with your provider. And that gut health is going to help with the neurotransmitter functions. It's going to help reduce the inflammation. We want to make sure our lymphs are draining, right? So that means walking. Exercise is any kind, but it's just walking. And after about 7 to 8 minutes, you're going to break a sweat, and that means you're going to start detoxifying. So detoxification, lymph movement is often linked together. And we really want to make sure that you are moving, because that is going to help not just with that, but it's also going to help your brain. We're getting oxygen to the brain. Sleep. So if you are not sleeping, you heard me say 90% of detoxification occurs in sleep. That means your brain is not detoxifying. So prioritizing sleep, getting what's called good sleep hygiene, right? No devices 30 minutes before bed, using things like your Zoom glasses. I love my Zoom glasses. It does make a difference. You can buy these really inexpensive ones on Amazon. That's a great buy on Amazon. They have them for kids, and prioritizing that components. Now, even within foods, right? You're going to break a sweat, and that means you're going to start detoxifying. So detoxification, lymph movement is often linked together. And we really want to make sure that you are moving, because that is going to help not just with that, but it's also going to help your brain. We're getting oxygen to the brain. Sleep. So if you are not sleeping, you heard me say 90% of detoxification occurs in sleep. That means your brain is not detoxifying. So prioritizing sleep, getting what's called good sleep hygiene, right? No devices 30 minutes before bed, using things like your Zoom glasses. I love my Zoom glasses. It does make a difference. You can buy these really inexpensive ones on Amazon. That's a great buy on Amazon. They have them for kids, and prioritizing that components. Now, even within foods, right? You're going to break a sweat, and that means you're going to start detoxifying. So detoxification, lymph movement is often linked together. And we really want to make sure that you are moving, because that is going to help not just with that, but it's also going to help your brain. We're getting oxygen to the brain. Sleep. So if you are not sleeping, you heard me say 90% of detoxification occurs in sleep. That means your brain is not detoxifying. So prioritizing sleep, getting what's called good sleep hygiene, right? No devices 30 minutes before bed, using things like your Zoom glasses. I love my Zoom glasses. It does make a difference. You can buy these really inexpensive ones on Amazon. That's a great buy on Amazon. They have them for kids, and prioritizing that components. Now, even within foods, right, there are certain foods and herbs and essential oils that can help with neuroinflammation and detoxification, things like parsley and cilantro. I have all this stuff other way. I have all this stuff in my book. It's going to be okay. And my book will guide you to some ways to support detoxification. We also have a lot of blogs on this, but detoxification has to be a priority. And of course, ways to reduce stress. So stress is our greatest threat to our physical and mental health. So what can we do to mitigate stress? Now, there are formal treatments for people who have neuroinflammation that due to pandas, infectious disease, things like, Advil and Aleve and ibuprofen over the counter and other treatments. You must work with a provider on that. But there are ways to be incredibly helpful. Somebody's saying great blog on ways to improve sleep naturally. You go to, which is thank you for sharing my own blog. But definitely what we want to do is really work hard to get all these lifestyle components, which I know everyone's always looking for the thing. That is the thing. And sometimes when your child is struggling or you're struggling with mental health, we are very overwhelmed by that. But we have to look at these things as an opportunity, because when one person in our ecosystem and our family is struggling, it's an opportunity for the whole family to get better. And when I work with families, I don't just treat the one person. It's everybody needs to make the changes to some degree. And know that neuroinflammation is highly tied to mental health issues. So when you're thinking about neurotransmitters, think about the neurotransmitters as being dysregulated due to the neuroinflammation. There isn't a psych med that's going to fix that. It has to come down through that inflammation. And that's one of the greatest tragedies in all these families that I work with, is they go down the rabbit hole of psych med to psych med to psych med to psych med. And we're just not there. They are listening in that industry, and they are recognizing very clearly that there is a connection. And please know that there's a ton of research about the connection between neuroinflammation and mental health. This isn't just Dr. Roseann's opinion. This is me educating you about the research. But I want you to start really thinking about root causes and what to do. Now, if you're looking for more support, you want to get one of my parent kits, which are incredible. I have these 5 parent kits in the different clinical areas. So, ADHD, inattention, executive functioning, OCD, PANS, PANDAS, anxiety, and then mood and behavior, which also encompasses autism. And they are a deep dive into what is the issue, how it affects you, and what the heck you got to do about it. Because you told me that's what you wanted, and that's what I created. But you can go to drroseann.com/help and take our solution matcher, and it will guide you to the right solution wherever you are, whether that's you want to work one-on-one with me and you're ready for that journey, because not everybody is. But think about neuroinflammation and start thinking differently about your kids' mental health, behavioral issues, or your own struggles, right? Because having kids that are dysregulated is very triggering. And neuroinflammation is something that can be addressed. As you heard, diet, exercise, lifestyle, supporting the gut, other interventions, working with a practitioner. So this is a place where every single person who has a child or yourself who's struggling with mental health, this is where you need to start. So I hope this was an insightful conversation. I hope I got you inspired to take action in a different way, get away from those psych meds, and look to what science is telling us is really the root cause.